Airline passengers in the United States will need to wear face masks until at least mid-September, the Transportation Security Administration said Friday, extending a months-old public health rule as air travel gradually picks up following a pandemic-induced slump. A study by United Airlines and the Department of Defense found last October the risk of catching the coronavirus on an airplane is virtually non-existent, as long as passengers wear masks. Using mannequins to simulate packed flights, researchers discovered a typical airline passenger would need to sit next to an infected person for 54 hours before being exposed to enough virus particles to contract COVID-19.1.4 million. That's how many airline passengers were screened at TSA checkpoints every day on average this month, up from March's 1.2 million daily screenings and February's 873,000 daily screenings. By comparison, just 109,000 people passed through U.S. airports every day last April, a steep decrease from 2.3 million daily passengers in April 2019. Airline passenger numbers rapidly plummeted last spring, when the COVID-19 pandemic drove most Americans to cancel their travel plans and avoid unnecessary in-person contact. Travel still hasn't returned to pre-pandemic levels yet, but airports have grown busier and airline bookings have increased in recent months. The Centers for Disease Control and Prevention says fully vaccinated Americans do not need to quarantine after taking a domestic flight, but public health officials are still encouraging people to stave off non-essential travel. U.S. air travel surges to highest levels in over a year. Forbes, can you travel if you're fully vaccinated? CDC says yes. But don't. Forbes.